the Trump administration has issued a new proposed rule on price transparency in healthcare. This is being called, and stick with me with this title, the calendar year 2020 Medicare Hospital Outpatient Prospective Payment System and Ambulatory Surgical Center Payment System Proposed Rule. We're going to call it the Price Transparency Proposed Rule. What it says is that any hospital that participates in Medicare must publish prices they negotiate with payers for standard items and services. It doesn't mean that it's going to impact only Medicare patients and services and items related to Medicare. That's just the way of picking which hospital it's going to apply to. So if you're a Medicare participating hospital, then this rule applies to you for all patients across standard items and services. So CMS calls it an effort to boost price transparency with a proposed 2020 effective date. This is not a surprise that this has come out of the Trump administration. It follows an executive order that was signed earlier this year. The executive order was called, a much easier title, Improving Price and Quality Transparency in American Healthcare to Put Patients First. And it's pretty self-explanatory. It's to increase the availability of meaningful price and quality information for patients. The executive order directed the Department of Health and Human Services to propose a regulation to require hospitals to publicly post standard charge information. So this proposed rule follows through on that order that says, okay, Health and Human Services, here's your rule. It includes definitions for standard charge, it includes definitions for items and services, and it even defines hospital in a way to leave no gray area of who has to publicly provide a list price and a payer-specific negotiated price for different categories of products and services. So it's telling these providers that a price must be available online, prominently displayed, not buried someplace on a website. It has to be prominently online with common billing codes, a description of the item or service, and in plain language, not in technical jargon, but plain language. So if it's a hip replacement, you call it a hip replacement, not a more medical term defining the bones or the services that might be related to that. So it's a way to make it much more transparent and really more readily available to find what the actual negotiated price for that service is. If you don't do that, you get fined. And it's a $300 a day penalty for not complying with the rule. Some critics said, well, that's pretty steep for a penalty, but CMS retorted saying, well, we learned our lesson last time. We tried to make compliance with a charge master requirement available and hospitals just did not comply, but there was no teeth to that rule. So they decided, well, this time around, we're going to make it stick, which is usually a good rule of thumb. If you have a rule that says somebody has to do something, you should probably have an enforcement mechanism to make sure it gets done. And $300 a day is pretty steep. Now, who is opposed to this proposed rule? As you can imagine, hospitals and insurance companies. They're the ones that vehemently oppose the proposed rule because they say it limits choice, it fuels anti-competitive behavior. A lot of both insurance providers and lobbying agencies for insurers have said they're going to sue the second this becomes implemented, should it be finalized, and insurance groups say disclosing rates may make bargaining harder. They don't want to tell you what they're negotiating with different hospitals and providers certainly don't want to show their hand and what the prices are and how they're negotiating either. Now, there are some proponents of this saying CMS is actually shining a light on major site of care differences so you can compare apples to apples for services a lot easier if you're a patient. And other people have said CMS is actually arming patients with better information and transparency about actual costs. Now, it doesn't apply to all costs and services. It's specified items and services as listed. So there's still ongoing discussion about what's totally included in that based on the new definition of item and services and the new definition of a hospital in this rule. So you can go ahead and read that proposed rule. Like we said, it's proposed. There is a public comment period. You can read more on how to send your comments in that draft of the proposed rule and the instructions coming out of CMS. You can actually read that executive order from June that instructed the agency to draft this rule. And we will keep you posted should this become a finalized rule with one more opportunity to submit comments. If you like this video, go ahead and hit the like button and subscribe to stay connected and up to date on issues like this.